Record it. Okay. Let me move this out of the way a little bit. Okay. So you all document what we call on the fly, meaning like maybe somebody's brings a family in and then you talk to them and then you document, right? You're not actually scheduling appointments or anything like that. So I love this because that's pretty much how we do it. We don't schedule appointments. We just go in and chart. And almost anything that you will need and if you forget how to get to it, always think of the Epic up at the top corner as this is your menu for everything. And so if you click here, things that have to do with your patients are going to be under patient care. And there's basically two different kinds of encounters that you're going to do, a regular encounter or a telephone call. And those are right here. So you have the encounter right here and a telephone call right here. Okay. I'm going to start with the encounter. So you can open up a patient chart first if you want to, but most of the time people will just do this because it takes you to the patient chart when you enter their name. Okay. So I'm going to go to encounter. This family came in and they wanted to talk. I'm going to click this. Now it's telling me enter your patient. And I think this patient is Chester Playground. I know, isn't that funny? Yes, here we are. So you double click on his name and this will pull up an option of how do you want to enter this encounter. So we're going to always create an encounter, which is right here. Okay. And then what should pop up is the date. Okay. There will be a type and then your name should pop up under provider and your department should pop up here. Okay. So depending on which department you're under, it will pop up here. And I will show you in just a minute because it sounds like you all document under two different departments. Is that correct?
Maybe just Maria.
Okay. So then I'll show you how to easily switch to a different one. And you can be in the patient's chart and then switch to another without logging out, and it'll stay in that patient. So I'll show you how to do that in a minute. But let's just say we are putting in this encounter, and let's say we actually did this encounter yesterday and we're charting today. You can change the date right here. So it will automatically populate to today's date, but we did the visit yesterday. Now, this is a part where the type of documentation, there are a million kinds of things, and you as a team need to decide what you are going to use. And you can do that office visit, and that will work. There are other things on here, depending on reports, and you might start one way and then later on decide, I think this other way is going to work better, right? And so just whatever. NFP, we all put in under documentation. And then we differentiate between what kind of documentation later on. So we all put it under this.
So that when you go into the chart to look for it later, it's always going to be
under the same thing. Yep. So I'm going to choose documentation just because this is how we've done it. And again, you choose it, select your date, and then you click accept. Okay. Once you click accept, it opens an encounter. Okay. It opens this thing up. I'm going to try to move this out of the way. And in the encounter, they may ask, and I can't really see here where it says episodes. For the majority of encounters, it wants to know the reason for the visit. And it'll say either reason for visit, reason for documentation, something that says, and this is where you're going to be like, this was an office visit.
This is kind of like PCW.
Yep. Yep. And again, it's like, it's just so weird. I don't know which of them have that kind of thing, like a reason for documentation, or sometimes I'll call it a chief complaint. But we're not primary care. It's not the same, but you can select something. Okay. Generally, so you can't see it right here again because of I haven't found anything that looks exactly like it, but it's going to be in the first thing that pops up for you. And like if you worked in a clinic, this is what the MA would fill out. Okay. It'll just be right there and it'll say, and a lot of times it just depends. I don't know how this is going to work, but a lot of times it won't let you sign your visit until you put a reason for a visit. So if you forget, it'll be like, go back here and fix this. It'll stop you. Okay. And that's where you can differentiate. So for NFP, all of us are under documentation, but if it's a prenatal visit, there's a button for that. If it's a postpartum visit, there's a button for that. And then in the notes is where or in the comments, they call them comments, and it will look, you'll see it in parentheses. It will look like where you can put office visit, home visit, things like that. Telephone call. There's so many different things that and this is where you all are just going to have to decide, how are we all going to do this and come up with a plan on how to do it. And like I said, I'll send you what we have and how we differentiate, and you can come up with your own. Okay.
So we have to type that in every time.
No, the first time. The first time.
And then once you put it in there once
you put it in there once, you have to favorite it. And then all those types
brings it up.
There, you just click it. They will just be there. So and you only do that one time, and because it's for each user. And so for yourself, if you add those to your favorites and put them there, it doesn't matter which patient you're charting on, they will always be there.
I didn't see that.
Yeah. And that is really, really nice. Always watch for these little wrenches. Okay. You see the little wrenches? Anytime there's a wrench, that means that you can personalize it and you can save things for yourself. Okay. All right. So we've pretended, because we don't have it, but we put in the reason for the visit. Over here on your right is where we will have your progress note. This is where you're going to type up whatever happened. Okay. And if you don't see it, sometimes it's because it got hidden on the side. So always, if you're like, oh my gosh, where's my progress note? Yes, open sidebar, and it'll just open it up. Okay. See this, sometimes if it's gone, like you don't see it, you see the blue over here? You just click on that and it opens it. Or you can click on here and close it. Maybe you're documenting and then you say, I need to go look at something in their chart. Chart review is where you will see all the encounters that they've had in the past. And you can see, because I have this open right now, mine is right there because I'm working on this right now.
It's interesting because I feel like this system is going to tell us more than we need to know.
Yeah.
Where in systems before, we had to go searching if we wanted a diagnosis. So I feel like this is a little more intrusive because we don't need to know all this stuff.
But you're right. I think with NFP, a lot of times it's the same, like the nurses will be like, I don't need to know what they told their doctor. I want to wait until they tell me about this situation. So if you don't want to look, no need to look. This is generally closed because you're going to be on
you have to go look for it.
Mm-hmm.
Yeah, it's just so.
But it is. Sometimes they'll have flags and you'll see like a little sticky note pop up that people put flags on there. Like for us, OB providers will put a flag and say like, she doesn't want to know the sex of the baby, or, things like that. And so you might see flags like that. I always just read them but I ignore them most of the time.
Can you do flags?
There are, you can do, at least from what I've learned in this area, is that you can do your own flags for yourself, not like to share with others. I think
So if
OB,
we went back into the client, our flag would be on that client, but
if-
no one else would see it.
exactly.
That's kind of cool.
Yeah. And a lot of providers like use it, you know, like remember to ask about her grandma, you
Yeah.
know, things like that. Yes.
Or, do not photograph.
Yes.
No media, right, there's the whole.
Yeah. And it will, but it won't be attached to, it'll attach to the patient, but attached to the user that put it there.
Yeah.
I think there's a way to get it so everybody can see it, but I don't know how to do that. And I think you have to have special permission for that. Yeah. So we wrote our note. There's our note. And we're all done. You have to click accept first. Accept basically closes your note, doesn't sign it, but it closes it. So we just click accept, and then it'll show there. If you want to edit it or delete it, you can still go back and do that. Okay. And
Nice, the one we have right now, I don't know that we could.
You can leave it open and keep.
you can leave it open.
Close it.
But if you, and there's a way, and there is a tip sheet that I saw on the Epic thing on making an addendum. So if you, oops, I made a mistake, you can create an addendum and go back and change it. It keeps track of what you're changing. So it'll keep past versions of it, but you will only see the most recent versions. So then once you're done, you sign the visit. And it will like check things for you. Okay. And you're done. Like it closes out the patient, you're all done.
But you don't have to save it. Just
Nope.
closing it.
Just closing it.
Okay.
If you click sign, it's saving and signing and closing all at once. A lot of the things right here, let's say you were documenting and then you got pulled away, Epic will sign you out. If you,
Will it save and sign?
yes, it saves it and will actually put it,
It won't sign it, it'll just.
it'll
so you
just
can
save
go back
it.
and edit
It will be up here. This is your in basket where the little envelope is. And it'll save up there and it'll say you have an incomplete encounter.
you
and
have to
so-
go in
And you go and complete it. And it's a really nice way because sometimes you get distracted with other things and then you forget. Maybe you finished it, you just didn't click sign. You will have them, it'll say that you have uncompleted work and it will be there.
So right now we have beans.
Uh-huh.
Finished.
If you haven't finished, okay, so it's gonna be like that. Okay, so now let's say we're gonna do, you're just looking up a patient for something. You can click patient lookup right there, or you can go to the Epic, go to patient care, and then do we have patient? Oh, they didn't put it in here because you have
That
it
would
on
be a
your,
really long way to do
Yeah.
it.
they already have it up here. It's, some people don't have it and they have to go through here. So that's why it like, because we don't know exactly what it's gonna look like, but you can personalize it for yourself. You know, like you can add things that you use frequently. You can add them to your list.
Can we send encounters to someone else?
So, where we were, let's actually go back into the one we just did. So I'm going to look up that patient that we just did, and you can go to recent patients and that patient will be there. So
Now,
there's
in
my
this,
Chester.
Can you look them up, last name, comma, first name? Or
You can
have to
do,
forward
like,
slash,
no,
it's
you can
like
do
a-
anything.
Awesome.
No, no,
Phone number.
no,
Nice.
it's so easy to search patients. So
And
easy.
you just pick the box and it's gonna do it.
Yep.
I love that.
Yeah.
That's the one thing I really hate about it.
Oh, I know. Me too.
I know,
Me too.
sometimes, especially those families that have two last names.
Then you're not sure.
If they didn't enter, if they entered it with a comma or.
No.
without- no, you got two last names and a middle name.
Yes.
Some people
It's
think they have to
so
be
hard.
really coded, and so we only get an MRN, and so then you have to go change it to MRN, but then it still doesn't like the MRN you're.
It's very hard. No, and this, you
can.
can put the MRN or the name in this section. It's really nice. So we're gonna go back and look at Chester, and let's just say, I forgot I needed to send this documentation to somebody. Okay,
I'm saying, can I start the
Yes.
documentation and then send it? to
You
Tracy
can.
and finish?
it'll be the same thing.
Perfect.
It'll be the same thing. So like right here, it says edit or addend. And then it's saying you already signed it. Do you want to addend it? Yes, we're going to create an addendum. And all it does is just open it back up for you. And so I would click addend here and then Tracy to complete.
Okay, so the first note's there. and
Yep.
you Just add to it.
You just add to it. And then you click accept to send messages. This is where it's usually in the wrap up function, which is like towards the end. And right here, this is for their follow-up.
Neat.
Yes.
Hold up, wait, go back.
You can
What'd you do? Oh,
click on
Wrap
a
up.
follow-up, so it'll bring it back to you in.
No, this is for the patient.
Oh.
This is like, I want the patient to come back in 3 months.
Find it, I need to talk to this patient. in 3 months.
You know, there might be a way to do that. I just am not sure. So let's take this off. Okay. So here is send chart upon closing. Now you're saying giving something for Tracy to sign off on? Is that what you're saying?
Right
Or
now,
is it like
we
work
do,
the, like you do
like-
something and then somebody else needs to do something?
Yeah, like a therapist downstairs will see a client for an appointment and realize they need some parent help, and so they'll send us a beam. And it's basically a telephone encounter thing. and
Yes.
then it
Okay.
shows what they did. And
So
it
then
comes to me,
we're
and I
gonna-
finish it and I close it. and
Okay.
say,
So then that is going to be more of a telephone call. Okay. You can still do this here. Like if they do a thing down there, a therapy, and they're decide this family needs parent to parent, they can send you the chart and it'll pop up on your in basket and they can send it to you with a little note that says family needs parent to parent support.
In basket is like other people, other users
Don't want
communicating with you,
necessarily-
like referral.
Mhm.
Right, okay.
Yeah,
So it's
that's
gonna
where
look-
it's going to look a little different.
These are gonna be our beats. So it won't be
Yeah.
obvious, no.
No, this is something, and maybe you all won't be using this, but sending a chart upon closing is kind of like the way we use it is like, let's see, let me think. Oh, a baby. We went and weighed a baby, and this baby's losing more weight than we expect. I would send the chart to the PCP and say, see baby's weight. I'll be there next week to do another weight check. So it's just kind of like keeping them in the loop. If you're using in basket like this, it becomes a part of the medical record. You know, and it keeps track of who was doing what and who sent, you know, a thing. I think for you all, you may not need to do that as in depth. It seems like it's more like the telephone call for
Well, it's
this,
not.
like you're not
I
going to
don't know why it
send a
would be
chart.
telephone call, but, it's like.
Well, it
a
could be in
therapist could
person.
send Tracy something and say,
Mhm.
hey, can you reach out to this family? Tracy will then pass it to me and say, hey, can you call this family? And then I'm gonna call the family and then I'm gonna document and say what I talked about. And then-
In this, yes. I think what you're describing is more of I'm trying to think, because I've seen in the clinics where they'll do a telephone call, but when it gets to the end person that's going to serve the family, they do a documentation.
So, yeah.
So we're not all
so
writing in
what-
that note.
No, you are not all
So
right.
that's how it is right now. It shows everybody that's
Mm-hmm.
touching this encounter.
So what happens often is clinician will send me a beam referring a family. And then in the beam, I will assign it to a member of the staff and then I will send it to them. So in my brain, inbox is gonna function in that same way.
And yes, or, and here's the other,
Yeah.
secure chat, which is a
Oh.
different one.
That's-
So in
Oh.
basket is generally more of sending a copy of the chart to another provider to keep them posted on the status of what's going on with
Okay.
their parent to parent. The secure chat might be a way of like, hey, this family needs,
Contact the family.
please contact this family. but that doesn't generally go into the patient's medical record. There's a record of it, but it is not a part of the medical record. And that's where I feel like that might be until you're actually communicating with the
No,
family.
that's great. A referral
Then-
can go there, hey, call this family, and then I'm gonna go and progress note it and say.
Yes, exactly.
So,
And that is in secure chat, and I'll show you how to do that too. So I don't even think you need to look at this. Let's ignore the
yeah, 'cause we
CC
don't
chart.
really need the chart. we
No.
just need them to- They say, hey, this.
Yeah.
family could use, or they'll
So
say.
this is in, I see wrap up is
Mhm.
clicked. This is in the in basket.
No, we are in the encounter. We remember we went back into addendum. So
right.
where we were, when it first pops up, it pops up under episode, but then the progress note is over here.
Right.
Okay, I just went into wrap up to show you about sending a chart, but I think it's not. It doesn't sound like that's what you're gonna do.
No.
So we're gonna ignore that part, but that is how you addend it. And you see, you can tell it's an addendum, so you're changing it. And then you sign your addendum. Okay, so the telephone call, again, same thing, under patient care, and then telephone call. And we're just gonna chart on the same patient again, Chester. This opens an encounter for a telephone call. You definitely want to, who did you have a contact with? Did you call them or did they call you? What was your reason for the call? So let's say the family called you and it was dad that called you. And you just click, okay? And it says incoming. You can go in here and like change the date and time, but you click accept. And now it's giving you all that information. Your reason for the call. Again, this is where you all need to come up with your own or things that work for you. I'm just going to say, I don't remember if advice is on here. Patient needs, I think it is, patient needs advice. Yes, patient needs advice. And then you could, put your little comments, close. That's all. And then you can see your progress note is over here. And you see how it's not even, it didn't show up right where you expected it to. You just sometimes have to look at the tabs. And then I just need to click the tab and it'll open it up. And this is a phone call. So let's say you are typing, somebody calls you, Tracy, and you talk to them about all this stuff. And then you decide, I need to assign this to Amy, right? Or I'm going to send it to Amy. This is where I'm like thinking about it. Routing. There it is, routing. So you already put your note in, and then you're gonna route it. And it's a patient call. You can see it there that's what it is. And you can do now I don't know how they're gonna do this, like if there's gonna be pools. I mean, it's only 3 of you. So I don't imagine that there would be a pool, but maybe there is. I don't know. I don't know how that's going to work, but you can assign it to a pool. So basically it gets assigned to everybody's, and whoever gets to it first, once they're dealing with it, the others won't see it anymore.
Oh, that's kind of cool.
So
Yeah, except
Yeah.
like sometimes I'm real specific, like I might want transition age to go to you.
Yes.
taking to go to one of you.
and in that case, you can put them here. So I'm going to send it to the family practice. That's just the code. Albert Perret. Oh yeah, that's a doctor. I'm going to send the patient call I would never send it to a doctor, but somebody, you're sending it to somebody, you just type in their name and it'll go there. But if you wanted it to go to a pool of people, you select the name of the pool.
Okay.
Okay. But let's say you're just sending it there. You can enter comments. You can see where it says non-clinical is what it said.
Where do you see that?
I clicked on it and then it was gone. But you can also see routing history here, and you can see like currently only Elizabeth Playground is involved in this conversation. But once they send it to Albert Playground, then his name will be on there. So that, and you can you can see where it says send and close workspace. You don't even have to touch that. Once you sign it, it will automatically send it. Okay,
So under running comments, that's what we.
you put, yep, that is correct. And then it will pop up for them and look, right?
In their inbox.
Uh-huh. You can see it says I have an open encounter.
Mhm.
That's what it will look like when you haven't signed something.
Cool.
So if I close out of this, I will still be able to see that.
I wish they would have chosen Epic years ago.
Me too. Okay, so we're going to sign that encounter. That's the telephone call. And then if we look up our patient, we should be able to see all of those things that we've just been doing. Like there's that documentation from yesterday. And you saw it doesn't have a description because it didn't have a reason for documentation or a reason for visit. But that's because we're under the physical therapy. But you saw with the telephone, we were able to do that. And this is what others would see. This is what they would see, except when you are documenting, all of your documentation will say me. When you're looking at other people's documentation, it'll have their name here.
And department.
The
so we would
department
be
is
in
over
the,
here. Mm-hmm. Yep. Oh, and that's what I wanted to show you is switching from one department to another. So let's say now you're moving. I mean, would you ever?
We can need to, if we could just change it in there where we're doing.
Where you enter the encounter?
Weird.
Yeah.
Mhm.
Well, it depends on cost centers. Well, but you don't bill.
Mhm. But I have to pull reports.
Oh, okay, so that makes it easier for pulling reports. Okay, that would make, yeah, so you do need to be in a different
Mhm.
department. So you don't have to log out and log back in under a different department. The easiest way to do that is by clicking this little arrow over here where it says log out.
Mhm.
And you all are lucky because at Farm Workers, we don't have this. You click the button and you change context. And to change context, then it pops up, this is the department you are in. And then you type in the department you want to be in. So now I want to be in pediatrics. And then you click continue, and then it kind of closes it, and then it opens it back up. Ignore this. This is something else that you will not have to do. It's just that it's telling me that this physical therapist doesn't belong in that department.
Mm.
You will not see this because you will have access to those departments. So I'm just going to cancel that. But generally that's what happens. Okay. It closes you out, but you see, like I can even stay in there with that same patient. I don't think does that happen where the same patient uses both departments? Yeah.
Yeah.
Okay. So then I guess, yeah, that would make it easier.
If the family was Spanish speaking, wouldn't we see that?
Yes, right here, generally, if you hover over this,
Mhm.
if you hover over this area, you can see their languages that they speak right here.
And what if, so generally, we're charting on the child, but it's about the parent.
Right.
So,
And that is, here, let's click on it. Let's see, is it gonna let me?
the child might speak English. but what about
Right.
the parent?
So let's look at, this is one of the things that I have an issue with at Farm Workers Clinic, because sometimes our clients are like 18, 19 years old, but they were under their parents. And so it says they only speak Spanish, but then when I call them, they speak English, and they had that because it was the parent that spoke Spanish. So you can put notes. Let's click on, so here, all I did was click on the person's name, the patient's name, and it brings this up, and then you can edit the basics. And so if we go right here, you can see spoken English. And then they even have a thing that says written language is English, and an area to put, do they need an interpreter? And you could put in the comments, parent It won't let me. Oh, you know why it won't let me? Because I'm a physical therapist and physical therapists are not allowed to be messing with this stuff.
Yeah, I was gonna say, yeah.
Yeah.
Makes sense that we'd be able to change.
Yes.
Well, once you have that note, where would we see that note?
So when you hover over this and you see the English, it will pop up here in this area under it, comments. And I'm trying to remember, there's lots of areas where you can enter comments. But the other thing that you can do, let me see. Right, oh, you can also do a sticky note here. Parent
So was that?
only
just a note
speaks Finnish.
That we can see or everyone?
My sticky note is your own sticky note. That's the one where the comment is for everybody.
We won't be able to do a comment.
You may, it just depends. I don't know. I
But
don't
isn't
know.
that Patient services staff.
I think it might be. I wonder, let's see, what does this say?
So right now, we
Mhm.
often get referrals,
Mm-hmm.
and so we're looking at the child,
Mm-hmm.
and in the child's chart, it has the parent's information.
Mm-hmm.
Will this have the parent's?
Yes, it will be connected. Because when you look, see here, the legal guardian. If you click that,
We're in a pediatric patient. Chester is only 9 years old.
we are in a pediatric patient. So, this, where's the patient contact? Oh, right here.
About that.
Yes. And that will, and generally you'll see it right there. It'll say legal guardian. So but even if you click here,
That
it-
shows most everything, but go down to patient contacts and click on Ronald Schweitzer.
yes. And that pulls up his information. And then look. Mm-hmm.
Okay.
That's what I'm gonna be looking for. when I
Yep.
get back home. Good,
Mm-hmm.
yeah.
And that is because the parent has their own guarantor account. And the parent, they have to, under age, is it 13 or 14? 14, they have to have a guarantor, an adult basically, and they have all this information because they have their own account. The patient, the child has their own account, but yes, the parent. So yeah, you can, and I don't even, let me see if it'll let me edit him. Again, I don't know. Let's see.
Yeah.
Yep, I can edit here. So then you can say, the person does need an interpreter, but maybe the child does not. Okay. I'm going to cancel that. So that's pretty much it. Is there something else you wanted me to walk through?
Can you hover over the tabs up to the top left?
Yes.
Just
Let me move this out of the way. This is a physical therapy thing. Okay. So I don't, brain, this is going to look different. You probably, even if you have this schedule, if you don't have appointments, you're not going to see anything there.
So we need to book rooms.
Okay.
Where's that gonna be?
Last I heard, it's supposed to be in Epic for booking rooms, and you would book them like you schedule an appointment for a patient.
A little more complicated than.
Yeah.
Will we have access, because sometimes, it would be nice to know when a family's coming to an appointment.
Yes.
Do we
So
have access?
yeah, so let me show you. So let's look at, and I don't know if he has anything, but when you're in the chart review, when you go to patient lookup and you're in the chart review, right here, do you see this where it says hide additional visits? If you click it, it will show you extra things, and generally that will show you, right now it says today, but it'll show you future visits up at the top. So you will be able to see who they have visits with. That is the only thing it won't show you is like if they canceled or rescheduled a visit. Like you can't see old appointments, but you will be able to see future appointments. Yeah. These up here again, like when you are looking, I just don't see how you all might do this, but I will show you where scanned documents will be. It's going to be under the media tab in the chart review. So this is this tab, and within the chart review, there's lots of stuff right here. And usually right here in the media, it doesn't have anything, but like things that get scanned in, ASQs or, you know, whatever, they get scanned in here.
What's that up at the top?
Mhm.
Patient station and master daily stroke.
I've never used this, but let's try it out. Let's see what it does. Ooh. Master daily. Oh, I bet that just means like,
Everybody in the department?
maybe. Ooh, do you see that?
Mm-hmm.
I wonder if that's where rooms are gonna be. But I don't know. I have never in Epic for us, we don't schedule rooms because we've always had to do whatever multi-care is doing. So
You're a farm workers employee?
mhm.
Oh, good, no, it's not.
Yeah. So yeah, I'm not sure about this. Anything else?
Yes, they show the diagnosis.
Mm.
No.
Generally in the problem list, let me
It feels like the current Epic that farm workers uses has much more information. Like, it's just a different view, and like, I
Really?
can see that when I open up farm
Oh.
workers Epic.
they're
Okay.
right here usually, right here. Problem list. This is minimized for
Yeah.
whatever reason,
Oh,
but it's usually here. This
If
is
they have
where
autism, it's gonna be there.
Mhm. And sometimes there's so many problems in the problem list that it's only showing you a few. So always it's a good idea to go and look over here on the tab because it's going to give you and it'll give you history. It'll give you ones that they've had that are no longer a problem. Mhm.
Used to be able to pull lists of
report.
Of patients,
that have.
a certain diagnosis.
Yeah.
I
And
think
that
you
was-
will. I think you will be able to do that. You just have to get permission. And as long as you have a good reason, generally you are. So I think what you're going to want to do is get in contact with whoever is the one that the Epic person for reporting. Because there's going to be like an Epic person and there's going to be a multi-care person. And you're going to want the multi-care person because they're the ones that are going to be able to give you authorization for using things a certain way.
That was really helpful when we're trying to do parent matches.
Yes.
Get a whole list of, all these families.
Mm-hmm.
That makes
That
it so much
yes,
easier to be
because
able to go
you can search pull reports by a million different things. I love it. I love it. But you do need permission. Like I'm like the queen of like reports. I love looking at data, but like I'm not allowed to and a lot of the stuff that I want to look at, it's just I want to look at it for my curiosity. I wonder what this looks like. I wonder what that looks like. I don't have an actual need for it, so I'm not allowed to pull a lot of reports. But that kind of thing, that's a very good use. So whoever your multi-care Epic reporting person is, that's who you need to like.
Did you give us permission? Is it something that we're gonna be able to go in there and pull the list ourselves, or will we have to
trace out
permission?
It might no, like it once they set it up for you, then you can tweak it in ways that you want. You just have to have the basics set up. But I think
But we would be able to pull out the report.
generally
ourselves.
they do supervisors, but if you feel like when you have like independent, people working, generally you can get permission for everybody to do it because that's part of your work is to connect families with similar diagnoses, right? So that could be something that you would request, and everybody gets access to that report. And then you tweak it by maybe changing the problem list or changing the thing that you're searching for. Yeah.
That'd be so cool.
Mhm.
It'd
Yeah.
make our job easier.
Yeah, lots to talk about around that though, too. Hey, can you go up to snapshot?
snapshot. Hold on. Where do you see snapshot?
In the bar up at the top, like the second, no, the third level bar, next to chart review.
Oh, geez. Sorry. I'm like, okay, snapshot. Come on. That's just like
Yeah, basic information.
basic information. You can
Covered what
see.
you Need to know.
Yeah.
Yes.
Immunizations and surgeries. And
Okay.
Mm-hmm. And it, oh, here's the other care team. Ah, I forgot. Let me show you right here. So you can add yourself to anything. The way to add yourself or to see who is a part of the care team, if you have an appointment scheduled, it automatically adds you as a part of the care team. You are not scheduling appointments, so you will have to manually add yourself, which isn't that hard. The way you do that, to see who's a part of the care team, you hover, and then it shows you. And in this case, there's only Jennifer Knowles is the only one. But if you wanted to add, you just click that PCP and you can add a team member. And so I'm going to add Albert Playground because that's, and then it says what their role is. And you would have to like look here to see what fits for what you do.
so we're hoping community health
Community
workers
health
can be
workers.
added.
And I wonder, and is it up here?
Yeah.
Nope. Social services. Oh, so instead of family medicine, it would be social work. And then I wonder if you can type your own. Nope, it doesn't. You'll have to, I mean, hopefully they'll add that. A lot of times they call, I mean, like for us in NFP, they call us case managers.
Is that higher than care manager?
I have no
Care
idea.
coordinator?
Oh,
Care
care
coordinator.
coordinator. Maybe that's what it, I don't know. Yeah, I mean,
We do care coordination.
mhm. So maybe it's that. And then you can put like a start date. Well, the start date will pop up, but you can also put an end date. Like if it's a certain amount of time, you can put an end date and then you'll just fall off when that date comes.
Because right now we go with ourselves.
Look.
Yeah, and that's what
receive
this is.
notifications about commissions.
Yes.
That would be nice.
Yes. So this, you would just check that button, and then you will get notifications and they'll come into your in basket. Another area, like right here in the comments, the way we use it, because I want other people to know, I will put nurse family partnership, and then I actually put our nurse's cell phone number on there. And then you hit accept, and now you get added here. And so anytime somebody hovers over here, they will see the other patient care team members.
Yeah.
I love this. This is and the other thing you'll see is if they are receiving care with another organization that also uses Epic, you will see them here too.
But what if it's an organization that doesn't use that?
They may not be there.
There's no way to add.
You can. You
Oh,
can
you
add.
can
You
add.
can manually, just the way
That
I
was
did
part
it
of
right
our-
now.
Oh,
One of our
okay.
training things, have you done those yet?
Yeah.
That, like, you can see outside stuff, but there was
Yes,
some
that's
special way to do it.
crazy.
Yeah. And maybe I should show you that part. Okay. I don't see it
But that
here.
wasn't to add people to care team. That was.
No, you can just see their
Yeah.
other providers.
So, this little button here, this is the Care Everywhere button, and you can hover over this and find outside charts. And finding outside charts, when you click on that,
They should
Oh.
have just signed off on that.
yes, and this is the physical therapist. I don't know why it's not letting me do it, but because it's not linked. It says this patient is not linked to any outside organizations. Okay. So, but generally you'll be able to click this button and then it'll pop up and show you what other ones are there. And does it require a signed consent or can you just do it automatically? It'll tell you. It just tells you everything.
So is this gonna make it easier for, so like right now, Eli sees a provider at Seattle Children's that sometimes comes here. But if there's an appointment booked here, Seattle can't see that. So
Okay.
is that gonna change?
Or you mean booked,
Julia Mitchell
For
works at,
book,
for Seattle Children's,
but booked at blah,
and if she sees Eli at Children's Village,
through farm
Seattle
workers.
Children's cannot see that.
Mm,
So
I
now
don't
that we're all
know.
gonna be part of a system, am I gonna sign something here at the village to say, yes, I want Seattle Children's to see
Maybe.
these notes? And then
I
they'll be able
think
to see
so.
those
They
appointments that I
should
have?
be able to, especially if it's,
'Cause that's a big deal for
yeah,
years,
it's
that's been
epic.
something that.
Yeah, I think
they'll
it
call and
should.
be
There
like,
is
"You need to
some,
see a doctor, or if we're gonna keep on this prescription," it's like,
I
"Want
did.
one." Well, they can't see that.
I think, because I have heard Paula say every once in a while that they can't see certain things from Seattle Children and they can't see some of their stuff. I'm not sure what that is. It's got to be a simple technical, somebody needs to do something on the back end type of thing. So I think now that both organizations are going to be on the same thing, I think there's going to be more of a like there's just more people backing up the fact that like we need to be able to see each other's charts. But sometimes you have to, we have to request this. That's the thing, is that sometimes you have to actually go in here. It says it's on and it's supposed to do it automatically, but in my experience, it doesn't always do it automatically. Sometimes I have to go in there and click the button and then it takes a while. It's like thinking and I have to go and do other things and then I come back and the stuff might be there. So, and it doesn't always show you, even if for another organization, it won't show you like future appointments. It'll just show you things that have happened in the past. Like they're not telling you about the Seattle Children's appointment next week or anything like that.
So what we need to do, like go live June 1, which actually Monday will be in the office because June 1 is a Sunday, right? So before any of us document, like on that Monday or when we're together, we'll need to go in, see what our view looks like, figure out.
So we all have the right.
Yeah, and it's all the same, and then figure out how we're going to identify our activities.
Yes. Yes. And you may go in to the activities like we were in that encounter, you know, a documentation encounter. And maybe the things that you want to call it aren't on there. Like, I mean, I don't know.
Attended event.
Yes, attended event, like something that's not going to be in there. So those are things that then you will have to, this is the optimization that they call it, where you'll have to talk to whoever the epic person is for multi-care, and say, I need these options for my team added. That's what we had to do for ours because there wasn't a prenatal home visit, you know, and so we had to have those added.
After 90 days.
Is that what they
Unless it's a
said?
priority, yes.
Oh,
They're not gonna do
Okay.
optimization.
okay.
on
So
90
then
days.
during that time, I suggest like whoever's charting for the first time, look through the options and just choose one that you'll use and then just, but you know, keep a little note for yourself of this is the thing that we want differently here.
We're gonna be able to pull reports off of that stuff.
You want it to be consistent.
Back when we were doing data for that stupid spreadsheet I kept to know what people were coming to. This way we could just pull support group, pull
Mhm.
event, pull
Yes.
one-to-one.
Yeah,
Nice.
That's I wonder how you're going to do group things. How do you do them now?
we
We
don't.
do it.
You don't?
Really, the main reason we use ECW is when we're doing care coordination.
Okay, which makes sense.
Yeah.
I was just thinking about
It's too
group.
much.
Yeah.
Because when we have 300 people coming to an event, like,
Ah,
there's no way.
no,
Of
no.
course, it's probably gonna be 125 parents, but still, that's
Yeah.
too much to document.
No. Don't, that doesn't.
So,
But back when we had CVIS,
You can,
we did a lot like that because it's so easy.
it
not in there.
was. Yeah. Yeah.
mm,
So let me show you the,
What did we have before ECW?
um,
Went from CVIS to.
Oh, gosh, it wasn't Cerner. Yeah, there was something in between there.
There wasn't
just
Cerner,
remember CVIS.
and then something, and then we went to ECW and that one.
Yeah.
Okay. So this is the tip sheet, and I'm gonna add this to that email. Man, why is it so slow? Okay, so this is and we have the workflow in here of like how we're doing it. We have like different kinds of visits. So the planned visit is kind of, well, necessarily for yours, it's not actually planned, but it's in that same way. Patient care encounter, enter your patient. So it's the same stuff that we just did. Create an encounter, enter, your reason. So this is what I was telling you under reason for documentation. These are hours that we had created for us. And so you could have your own created on here and they just pop up and then you just click the one that is what
Can
you
you click
chose.
two?
You can click two. So if you're doing two different things, you can do that.
And it allowed you to pull reports off of this.
Yes, off of this. So like when generally like the reporting that I do anyway to look at documentation, I pull all of the things that are listed as documentation under CV Community Health Services, like because you want your department and your type, and then you can like hone it down to the reason for the visit as well. Yeah. So there's that. And this is what it used to be. Now it says progress notes, but it's that same idea of putting in your progress note. These are our templates. Do you all use like a certain way of documenting, like things that you always ask, always check in on? No, it's all different all the time. Okay, so then you won't need to worry about templates. What else? Okay, so then I have different.
Took that, the little, top 10 resources and we just put them in there.
You can like resources that
Like
you.
DDA, like the things we most commonly talk to
PDA,
families about.
SSI, PAID.
Okay, so if it is, because it does cut down on documentation when you're able to just check a box.
Yeah.
So if you wanted to create that into what we call a smart phrase, that would be, and I can show you, I mean, it really is simple.
I remember that from the training. And I thought about
I can show you, let me just show you real quick. Let me see. I don't think I have it here. So smart phrases are going to be, again, up here in your Epic and right here under smart phrases. Okay. And if you're going to create a smart phrase, like in our case, like I name everything, I start it with NFP. And that way I can just put .NFP and all of ours come up. So we can say parent to parent. What did you say? Top 10? Is that what you said? Okay. So right here, you just paste whatever it is that you have with little check boxes. So like in our case, I have, is it this? Yes. Okay, let's prenatal visit form. Ours is like super involved, but it has all these check boxes. Like, did we discuss these things? And so let's just say we do this. I'm just going to pretend this is your top 10. Where is the Epic? And then it puts it in there. And I'm going to share this with Albert. Oh, there's a lot of Alberts, huh? And you can allow them to edit or not, but you can share it with all your team. Okay. Save it, accept. And now if I'm going to go chart on this kiddo, let's just addend this again. So I can just go straight to the note. Where did my note go? Where's my, see, look, this happens to me sometimes too. I'm like, where's my, this is my visit navigator. Am I on the wrong kid?
No, it's Chester.
Where's my notes?
It says Elizabeth Playground. Oh, that's a PT.
Where is, and it's not over here. Maybe it's not letting me because I already addended it.
Is it still open somewhere?
Maybe it
Did we
is.
finish addending? the
Let me-
other addendum?
I thought so. Okay, let's just do another one. Let's just start over. Who's, we're gonna do somebody else. Okay, so patient care encounter. Create an encounter. Where's my note?
It's just asking you to sign visit.
Yeah,
Just do
Okay.
Plus care coordination note.
where did you see that?
At the
You're
top,
bringing the gift
right?
for Abby?
Down one.
Yes,
okay,
okay.
down there.
No,
I
because that's a
know.
little bit, that's like a summary. This looks really weird. I'm not sure what. Oh, it's because I'm in a different department.
Oh.
That's why. Oops.
Okay, 5:15.
I'm gonna record this. It's recorded, so I'll save it. It's because I was in a different department. Remember, we tried.
Gonna be able to go very long. I'm just gonna kind of give her a hug because our caregiver schedule's messed up because Kristen's on vacation, so Echo's been working days. So she's off at 3, and so Lonnie's on his own. We don't have an evening caregiver. So switching the dinner, it's like, oh, poop. So Echo's leaving right now, and now Lonnie's home alone with Eli till I get home.
Can you,
So I'm
are
working
you
till
working till?
5
Oh,
with ballet. And then,
Oh,
so I'll just run out and say hi.
unless Lonnie could hang a little bit
Yeah.
longer.
Unless Eli's napping.
If you
I'm
bring
checking
him
on him.
food, maybe he would.
Well, if Eli naps, then he's not doing much more. So let's see.
So in your progress note, you could put dot P2P because that's what we called it,
Right.
and then that will come up. You just double click it, and then it's there, and then you can check the ones that you referred them to or discussed.
So,
And you know, and
But
let me.
meanwhile, we have to make this little thing in a Word document first, so that we can copy it.
Yes,
Okay, can you copy something from Excel?
maybe. I think so.
Actually, I think that's just a publisher.
You should be able
Whatever you
to.
can copy
You
from
can
somewhere.
copy, yeah.
Okay.
And let me show you this other cool trick. If you are doing like, let's say this thing with this kid, but you see the family again, you can copy forward a previous note that you wrote. So like, I'm gonna copy this one forward. And then it just puts it in there for you. And then you can go in there and, well, this time I didn't give them this, I gave them this other one.
yeah, that's cool.
So we use that a lot
Mhm.
because,
Actually, if we had that, and if it was easy to use, I could see us really
Mhm.
doing that
yeah.
and saving us time.
So those are just some of the things.
And it could be,
Rather than
It
typing
could-
out, told family about DVA.
Yes.
Try and pave and.
but also it could be, but you can't pull reports on that.
You cannot, hold on. You could, if you make it a smart link. Okay,
Okay, because what I'm wondering, like.
To know
exactly where we put.
all
here's
the,
Parent event, here's parent group. Big shots, I don't know. No,
I mean, if you still have to do that for 150 kids, that would be a lot. But it is,
we would use it for parent coordination.
but people do use it to be able to see like what, but it's called a smart link.
Okay.
To where you can like pull like in all of the notes from here to there in parent to parent, which of them had this box checked.
How many of them got DVA?
Uh-huh. Yep. Yeah. And again, that's definitely going to be during the optimization time. And then getting somebody to show you how to, because that is something I've never done is smart links. I've never done that. So, but yeah. Okay, I am going to close out of this.
I am gonna go as well.
Okay,
You-
you're
This is
welcome.
So helpful.
Yeah,
Oh my gosh.
And I'm going to, let's see, how do I stop recording?
You just did. Oh, you stopped share.
Oh, right here, right here. No, that's not it.
We're just stopped
Recording right here.